For the first time, a case of the Ebola virus has been diagnosed in the United States. Doctors say a man visiting Texas from Liberia is now in isolation in a Dallas hospital. Federal health officials are now tracking anyone who had close contact with that man. At this point, no other Ebola cases are suspected in this country, but workers at UK hospitals say they are prepared to treat anyone with the dangerous disease. WKYT's Jerica Insko explains.
Following CDC guidelines, doctors here at UK hospitals say they've been prepared for months for if Ebola were to reach Lexington. Now that Ebola has made it to the United States with the disease showing up in Dallas, Texas, hospitals are taking precaution. At UK Hospital, doctors there say they've had measures in place already that are very similar to treating other diseases. But a few new preps have been put in place, like asking patients more questions, especially about their travel history, and also extra training for physicians to be able to better spot the symptoms of Ebola patients so they can act fast.
So the key is just getting them out of any common area into a private room with a private bathroom as soon as possible.
As for an outbreak in the U.S., the Center for Disease Control and local doctors say it's unlikely.
Right now it sounds like in Dallas they're doing their contact tracing and trying to get all the potential contacts that may have been exposed. And this is not an unusual process for communicable diseases in general.
This doctor says the CDC has found that most hospitals like UK already have proper tools to treat Ebola virus disease. As for Ebola reaching the bluegrass, that doctor says that Kentucky's chances are the same as any other state. At UK Hospital, Jerica Insko, WKYT.
And you should know that you can only contract Ebola getting in close contact with someone who has the disease and exchanging bodily fluids with them.